All right, welcome guys. I am Dr. Booth, and this is...
I'm Dr. Zach Couples.
And we got one more.
Dr. Logan Ponce.
Dr. Logan. All right, so we are going to go over shoulder stiffness with overhead movement. Very common for us in our clinic and also on the gym side of things. So when we have these types of ailments, we want to first figure out what's going on, and then let's figure out some strategies on what to do about them. Real commonly, what happens first in the spine and the rib cage, Z-cup, what do we got?
Yep, so we need to talk about what should happen when you go overhead without any stiffness or discomfort. So there's certain movements, as these wonderful doctors will talk about, that should happen at your arm and your shoulder blade. But your shoulder blade sits on your rib cage and your spine. And a lot of the muscles that attach at that area have also attachments at the spine and the rib cage. So if you have impaired motion in those regions, that can impact your ability to go overhead. So the rib cage has to be able to expand and stretch out in order to make that happen. And if you can't do that, you're going to have reduced motion at the shoulder blade, which will impede the ability for you to go overhead.
Mm-hmm. So that is our spine and our rib cage. It needs to expand. It needs to be a pliable surface because the muscles attach. What happens at the scapula when there's shoulder stiffness? What needs to happen, and then what do we need to really focus on?
Yeah, so the scapula, when we're doing any overhead motion, there should be an upward rotation of the scapula as you reach up overhead. So if there's a limitation of that, you're not going to have as much room to move. There could be some potential impingement and inability to really reach all the way up overhead. So that upward rotation is imperative that we have when we do any overhead motions.
Okay, so that's the scapula, and then it's sitting on the spine and the rib cage. Then finally we get all the way up to the arm. The arm needs to not do all of the work, and this is commonly what I see is that the arm tries to do a lot more because all the other stuff doesn't work as well. So we have these ratios. I don't know the exact ratios. I'm sure you probably know.
2.4 to 1 scapula, or humerus to scapula.
2.4 to 1. Write it down. So the scap needs to move in accordance to how much the arm is moving. If the scap doesn't move, then we have problems at what's called the glenohumeral joint. So it starts to bump into things, we get pain, we get stiffness, our body starts to defend itself because it doesn't like those types of movements. Things start to get inflamed, and then our body starts to have this stiffness feel. So the glenohumeral joint needs to move just as much as the scapula is allowing it, but then again as much as the spine is letting the scapula move. So they all have a big portion of it, and what we want to do is show you ways to help reset each of those sections. So first and foremost, we're going to go back to the spine and the rib cage. What do we got, Z?
So you want to think of this as what we're trying to do is we're trying to build a house for you to go overhead.
Mm-hmm.
And you got to start with the foundation. Since all of the shoulder stuff sits on the foundation, which would be the spine and the rib cage, we're going to start there and then we'll work our way outward. So to increase spinal and rib cage motion, getting on your hands and knees, if you please, is a great starting point. So for that,
hang on, pause.
we're going to start here. So what you should feel with this is your abs working, and you'll feel some nice stretching in your upper back and the sides of your rib cage. So you want hands and shoulders on top of one another, knees and hips on top of one another. You're going to get a nice tuck of the hips. You want to think about reaching with your chest staying parallel to the ground. So not crunching, because if you crunch, you're not going to get the stretch needed in the upper back. So chest stays parallel. Once you're in that position, you're going to just breathe it out, in through the nose. Let out a nice long exhale. You're going to feel your abs work. Keep that work in the abs and breathe in, and you'll notice upper back starts to stretch on that next inhale.
So big expansion. When he was talking about expansion in the beginning, that's what he's trying to drive with this movement. There's a lot of expansion.
Yep. Now if that's easy, which it isn't more often than not, but if it is, once you get good at that, you can then switch to one hand. I usually tell people just look at your palm, see what's going on there, see if you got any hair on your palms. And do the same breathing. What that will do is that will increase the movement that you're trying to drive through the spine and the rib cage, because now you're getting a little bit of twisting and rotation happening in that position. And once you have that down, then you can move on to drill number 2.
The scapula. We're gonna
Yeah.
get scapula.
So oftentimes people have a lack of awareness of movement of the scapula and shoulder blades. Oftentimes things that we do every day is forward in front of us, so oftentimes we set our shoulder blades forward and it just locks here all day long. That can limit a lot of the reaching overhead motions that we have. So first, let's get making sure that we have good motion of the shoulder blades along the back of the rib cage. So we're gonna do a serratus punch. If overhead motion is painful at first, I like to start off on your back, supine. And from here, keep your elbow locked out. You're just gonna reach, rolling that shoulder forward. And then after that, you're gonna pull it back, squeeze the shoulder blade together. You'll feel a nice activation of back muscles here. And then you're just gonna reach forward and go back. Getting motion. Now, technically, this is protraction, retraction of the scapula. So again, this is for painful overhead motions. Once you get that going, you're feeling nice motion of the shoulder blade. Then from there, we can transition to the overhead. Elbow locked out, and from there you're gonna reach. You'll feel, you can use your other hand to feel the bottom corner of the shoulder blade. Feel it swinging up as you're coming, and then pulling it back down. Get a good squeeze of the lats and serratus. Reach, feel the traps, serratus working, and then pull back. Getting motion in the scapula and the shoulder blade.
So now we're going to bring it all together. So if we want to, again, start getting our hands to go up over our head, a cheater way to do it is a little combination of both Zach and Logan demonstrated. We're trying to set the rib cage. We're trying to get some really good expansion into the ribs. We're trying to get the shoulder blade to move a little bit. And now we're going to load the arm a little bit. So this is what's called closed chained movements, meaning my hand's not going to move, my body's going to move around my hand. I think this is the best way to start introducing things. So if we're into what's called a bear pose or quadruped, we're going to start here, same as Zach, getting our hands right underneath our shoulders, get a nice good tuck, get into a good position here, and then really working on that shoulder blade movement as we raise our hips up, let our head dangle down. And now you can see we're putting it all together. We're getting the shoulder blade to start moving. It's starting to swing down, just like Dr. Logan was saying. We get that swing, and we're keeping as much of the rib cage and tuck as we can during the whole movement. So those are definitely good strategies to work on all three of the areas that we've talked about. We got the spine, the rib cage kind of combo. We got the scapula, and then we also got the glenohumeral joint. So if you have any more questions about how to make some of this a little bit more catered to you, maybe this doesn't solve all of your problems, you know where to reach us.
Give us a call, 702-558-2151, or check us out on the web at www.elevatesph.com.
All right, guys, we'll see you next week, okay?